Well, hello again, everybody. It is Dr. Catrice Austin. It is Thursday, just one more day. I know I can't wait. I know you guys can't wait. So I'm a little behind. I have a few questions out there that I wanted to answer, and this one goes to you, Lashana Williams. I'm going to read the letter. I always thought I had a nice smile growing up. After talking about teeth just in general with some colleagues, I realized I no longer had the smile I thought I had. Needless to say, I didn't smile at all in my 2011 graduation photos. Congratulations on that graduation. When I went to the dentist here in Jersey City, the doctor said I suffered from severe bone loss and that the separation in my teeth was hereditary. She said that braces would not be a good option because of the bone loss. She offered me this snap-on smile that looked like bulky dentures. I'm a 39-year-old woman and I really don't want to look like I'm wearing dentures. Can't blame you. Is there any hope for someone with my situation? I really want to smile again. Thank you, Lashana. I really appreciate this letter. So, the first thing that we want to address is the bone loss. Gum disease, don't feel alone, because many people over the age of 35 suffer from advanced gum disease, and it's mainly because we need to brush better, and most of all we need to floss. Brushing and flossing will keep the bacteria off of your teeth and help support the structures, your teeth and your bone, that keeps your teeth in your mouth and from getting loose. So do not feel alone. There's many people like you, Lashana, that has bone loss and gum disease, and that's what I'm hopefully trying to remedy with all of these videos that I do on a regular basis, is to get you guys motivated to brush at home, to floss at home, and most importantly, if you're overdue, get to the dentist. So let's talk about where you're at now. Since you have bone loss, and actually I have an x-ray over here of a patient that has bone loss, so I'm going to have my wonderful assistant Fatima just come on over here. So if you look on the x-rays, which is really important, a lot of people don't think x-rays are necessary. They are totally necessary, because we can't see between the teeth and underneath the gums where the bone is. So this is an example of a patient that has bone loss. This white stuff right here is the bone. It should be all the way down here. So the bigger the triangle space is between your teeth on the x-rays, the more bone loss you have. This is the bottom of the tooth. So as the bone continues to deteriorate, your teeth will get looser and looser. So when we really try to catch bone loss early, and in my office we have a really strict and thorough gum evaluation and gum therapy program, because if we catch it early, bone loss can be prevented and your gums can be healed. So if you have bone loss, we need to see exactly how in-depth it is to really make a determination of what your options are. If your dentist said that you were not a candidate for braces, I'm assuming that it may be a little bit more risky because of the bone loss, because if your teeth are already loose, you don't want to move them with braces, and if they're loose with not a lot of bone support, then we won't have anything to keep the teeth in the place once we do move them. So if you have bone loss that is beyond what braces can do to move your teeth together, you do have the options. Well, I really need to see x-rays, Lashana, but your options may be to extract the teeth that aren't so strong and maybe get gum therapy for the teeth that can be strengthened. There's all types of surgical procedures that are out there. We have great oral surgeons here in our office who can actually, we have artificial bone. I don't know if you guys watch Sweetie Pies, but there was an episode where she actually got bone. She didn't want the artificial bone, so she took bone from her hip and placed it in her mouth to restore her teeth. So there are options. You don't have to go that extreme. She just didn't want artificial bone, but we on a regular basis can place bone in areas where there's bone loss to strengthen your teeth and then restore them. If the teeth are not restorable, then we can pull the teeth. I know it sounds harsh, but any teeth that are not restorable, we'll take them out, and then we have many teeth options to replace your teeth. There's dental implants that make you feel like you have your own teeth. There are removable dentures or implant supported dentures. There are so many options that we have, and dentistry has advanced tremendously in the last few years. Your dentist was suggesting this is the Snap-on Smile. It is like the cosmetic version of the grill, but yes, what it is designed to do is to slip over your natural teeth, hide your teeth, give you a pretty white smile, all with one low cost of the Snap-on Smile. Here is some examples of what the Snap-on Smile can do. So this is someone that has crooked teeth and teeth that are not aligned, and then you take the appliance and you literally snap it over your natural teeth. It sits there. You don't need glue or anything like that. And so you can see the before and the after. But if you imagine putting this over your teeth, you got to have strong, sturdy teeth for this to support, or your Snap-on Smile will not be successful. So the Snap-on Smile is an option for someone who has a lot of dental problems, like missing teeth or teeth that are not in alignment, and you want to give yourself, all with one appliance, a enhanced smile. It takes 2 visits, about 14 days apart. There's no drilling, there's no needles. We didn't just make moldings of your teeth and send away for this appliance. It comes back, we fit it over your teeth, and you have an instant smile makeover. It doesn't permanently solve the problem, but it will mask and give you the appearance of a beautiful smile. Again, for one low cost, it can solve multiple problems, but it's not my first choice. My first choice is always to fix the problem permanently. But if you're in a bind, you're in a budget, you need a smile quickly, the Snap-on Smile is another option that a lot of dentists are not aware of or are not trained to do. I've been doing them for many years when they first came out. But again, it's not my first choice. If done properly, because not everybody is a candidate, if done properly, it actually does look good. So, Lashana, I would say get a second opinion. You're welcome to come to my office. Our surgeons will do a consultation, see if we can give you bones, see if there's any options to strengthen your teeth, and of course try to save any teeth that are savable. But I know it must be a difficult thing. You want to smile again, and that's what I'm in the business to do, to help people smile again. Make America smile again, like Trump wants to make people feel that America can be great again with his, I don't know, I ain't gonna even go there. So anyway, my next patient is here. I've been waiting to see her for such a long time that I'm not gonna keep her waiting. So I will see you guys soon. I've got more letters to answer, more questions to answer, more videos to shoot. I've been so busy this week. I had so many topics that I wanted to talk about. But if you have a question, a topic that you want to hear, call. Actually, you can call me and tell me what you want to hear, but email me, send me a letter on Facebook, and if you need dental treatment, call me. It's 212-262-6054. We are located on 57th Street in New York City between 6th and 7th Avenue. So I've got to run, but hopefully I answered your question. Bye.